Hi, this is your Houston Chiropractor Dr. Gregory Johnson. We have Vanessa in here visiting us this afternoon for the very first time, right?
Right.
Yep. And Vanessa has had some injuries to her lower cervical spine and her shoulder, out into the right shoulder, and has problems moving her right shoulder and has pain deep down in the joint. She gets neck pain and stiffness, and she also gets occasional pain up here in her suboccipital region that kind of mimics a headache, but it's more of a pressure feeling, isn't it?
Yeah.
Yep. Okay. And then she has pain down in her thoracic spine and rib cage, which causes her to have some difficulty breathing at times too, right?
Right.
And then down in the lower back region, she gets pain down at the bottom, the L5-S1 area. She gets right leg pain down into her SI joint and down into her posterior knee area. And then she also does get right knee pain as well. And she's had numerous injuries in her past that we documented, and no broken bones or fractures though.
No.
Okay, so we're going to show them how we're going to adjust you first. We do educational videos here, Vanessa, so I'll be explaining a lot of what I'm doing on that, okay?
Awesome.
Let's have you flex your head forward and backwards for me. And then back to neutral. Okay, see how your head's forward and kind of taking off to the right?
Mm-hmm.
That's how you're sleeping in most probability.
Yeah, I sleep on this.
Yeah, but your head's tilted off this way.
Yeah.
Yep. And then your pelvis is pretty much down the center, except it's a little more room here than you have over here. So it's shifted a little bit to the right, which makes sense when you're having that right SI joint pain down into your right thigh. Okay, so I've already done her orthopedic neurological examination and history, so I'm not going to repeat all that. That's all patient privacy stuff too. Okay, Vanessa, I'm going to have you lay on your tummy again, face down. Tristan tells me you've got quite an Instagram following. Okay, that tightens up, doesn't it? In your low back and your thighs? Yeah. So, she's got bilateral SI joint subluxations. I did a sacrodeviation test on her. Go ahead and lift your right one up. Okay, relax. That hurt too, didn't it?
Mm-hmm.
Okay, now the left one. Now that one went higher. Did that not hurt as badly on the left side?
Right.
Okay. So the first thing I'm going to do is I'm going to adjust her right SI joint. Let's scoot you down this way just a little bit, Vanessa. Okay. You're going to feel these pieces dropping when I adjust you. Now these will probably be a little sore at first because they've been out for a while. There. Okay. Loosen this up. I'm an old-fashioned bone mover chiropractor, you know. You probably knew that if you watched any of my videos, right? There we go. Yep. Atta girl. That's it. Yes, ma'am. I'm gonna straighten your ass right out. There you go. Perfect. You feel all those?
Oh my God, yeah.
But looky there, you're exactly even now, and I bet you this feels easier coming up this time than the previous one did.
Oh yeah.
Yep.
Oh my God, yeah.
Pretty cool to see instant results, huh?
Mm-hmm.
Okay, you're gonna feel your head popping up a little bit on this one. I'm gonna put the curve back in your cervical spine because yours is starting to decrease and reverse even. There you go. Good. Okay, let's turn you on your back now, please. You okay?
Yeah.
Okay. It's a little different than what you've been used to, I bet, huh?
Yeah. I'm shaking a little bit.
It's all right. Everybody's nervous the first time. There we go. Good. That's it. Okay, slide down this way just a bit. And then let's put both arms out to the sides for me. Straight. Atta girl. Okay, I'm going to adjust your clavicles and then your anterior ribs right here. These will probably be a little sore, but this will open up your breathing. There you go. You can relax your hands on your tummy there now. Let me have this right leg. Atta girl. Now you should have felt that from your knee all the way up into your lower back.
Yeah.
Good. And your hips.
Yeah.
Good. That's it. You feel that one the same?
Yeah.
Good. Okay. Let's set you up, face that way towards Tristan. There we go. Okay, so now I'm gonna get to this right shoulder. It's probably gonna be sore going through this passive range of motion all through here, especially right in here, huh?
Oh.
Sorry. Feel that popping and grinding?
Oh.
Woo! Boy. You've got a labrum tear in your right shoulder. There we go. I just adjusted your glenohumeral joint. Did that hurt when I adjusted it?
No.
Okay. We'll get you lined up here in a minute where you'll be able to move that easier. I know it's sore right now. But you're a champ. You haven't screamed once. We get some real drama queens in here occasionally.
Really?
Mm-hmm.
And it's usually the guys.
Yeah, it's usually the men are worse. There we go. Okay. There we go. Okay, let's come over here on this table. You're probably going to be in the last two pegs on the table, just like Renee. Let's have you put your butt there, hun. Head up that way. There you go. Okay, relax your hands on your tummy there. Good. Yep, it's going to feel tight, and it should. Now, girl. Let me make sure I get this one in there all the way. Okay, there we go. Better. I know that's tight. Okay, just let your legs bend and relax naturally with the table movement. Now I'm going to decompress your spine from your skull all the way down to your pelvis with this one. So what you can do to help me is just keep your teeth together, breathe through your nose. She's kicking plenty hard beforehand, so we'll make sure she is afterwards too. All right, now just deep, easy breathing with your left ear. There you go. Now you should have felt that go all the way down.
Oh shit.
Did you?
I did.
Good, okay. Yeah, see, you're still kicking, you're good. Okay, so now I'm going to adjust your cervical spine with the Palmer Diversified Rotary Brake. Yes, ma'am. Tilt right. That's it. Yep. You're noisy one, aren't you? Crack addicts definitely gonna love you.
I got the giggles.
At least you're laughing and not crying. That's good.
It's weird.
All right, let me help you up here. When you get up, you always kind of want to sit up sideways, because if you sit straight up, the vertebra will slip backwards and it'll pinch on the nerves even more. Okay, come over here and stand in front of the mirror for me. Okay, so let's have a look here again. Flex your head forward and backwards, please. And then neutral. Okay, so you're not as far right, but you're still leaning that direction. So here's your homework. Pull both shoulders up with your traps. And keep up farther. Now pull them back with your rhomboids like that. Kind of extend these backwards. This might stretch that shoulder out a bit, but that's what we're wanting to do. Okay, now here's your biggest issue. Your head's forward and right, so we're going to bring it straight back. Translate left. Look in the mirror for me. Translate left. Now look at the wall behind you. You're going to feel a little tap on your atlas here and here. Okay, relax. Now, try that very same movement again. Now that should have felt smoother to you that time.
Oh yeah.
Can you breathe any easier right now?
Yes, I can.
Wonderful. Move your right shoulder around for me. Tell me how that feels compared to when you walked in the door.
Holy cow.
Different, huh?
So much freedom.
Cool.
Yeah. Oh wow.
Okay, that's my job. So what would you have to say to our crack addict fans around the world about your very first chiropractic experience here at Advanced Chiropractic Relief?
It was amazing, just what I expected.
And you expected that because you've seen our YouTube videos,
yeah, I was
right?
watching you for like a whole day.
Did you get exactly what you saw in the YouTube
Yes,
videos?
I did. Yes, I did.
And it works, doesn't it?
Yes, it does.
Yep. Well, thank you for sharing your story with
Thank you
everyone
so
on
much.
YouTube.
Thank you.
This is your Houston Chiropractor Dr. Gregory Johnson coming to you from Advanced Chiropractic Relief in Houston, Texas with Vanessa, also from Houston, Texas. We'll see y'all soon.